Hi, Kellen Rouse again. So this is just going to be a very brief update for those of you who do follow me, my very few followers, subscribers. I'm appreciative for you guys. So this is my post-surgery update. So as I talked about in my last video, I went in on January 31st for surgery. Today is January 24th. So it's been about 3.5 weeks since I had surgery. And everything's, for the most part, is going very well. So I did have extensive surgery. I didn't get into all the details in my last video, and I'm not going to in this one either. But there were 7 procedures by 3 surgeons at the same time. So while none of the surgeries that I had were particularly dangerous, or more dangerous than any other surgery, all of having them done all together was a lot. I'm glad that I did go ahead and get it all done, although the first week after was really rough. But I am so far happy with the results. And there were a couple of things that I wanted to talk about that are relevant to my trauma healing journey, my EMDR journey. So first of all, I've only had 2 minor complications so far, one of which is resolved and one of which hopefully will resolve within the next few weeks. One is that I have super sensitive skin, and I had an allergic reaction to the surgical glue. Because they glue the skin. When you have arthroscopic surgery, they often glue the incision on the outside. So they'll put stitches on the inside and stitches on the inside and or sutures or whatever, and then glue the outside together so that you don't have these like stitch scars, right? So I was allergic to that, and my belly kept like itching and itching and itching and itching and itching, and I couldn't figure out what was going on. I thought it was just from healing or something like that because I had so much work done. But when I went in for my first post-op 2 weeks after surgery with my OBGYN, she said, "No, honey, this is you're having an allergic reaction, and you in fact have a minor infection in your belly button," right? So we handled that, and that has resolved. The other thing that I've been having that actually sucks way more is bladder spasms. Unclear exactly why, but I started feeling like I had a bladder infection or a UTI, but my urine was coming back showing nothing. So I had to go and have an appointment with my urogyne. And the nurse practitioner there said, "Yeah, I think you're having bladder spasms." So I'm now on a medication to control that. It's an antispasmodic for smooth muscle tissue. I'm learning so much medical jargon here. That turns my pee blue, so that's fun. But it has relieved a lot of the discomfort that I was having. So other than that, I haven't had any complications at all. A few things happened that are very relevant to my healing journey. So one is that my daughter and my boyfriend took care of me. In fact, my boyfriend is still taking care of me. And, beyond possibly, newborn, from the time that I was a newborn, perhaps, I've never had anyone care for me for that long, like wait on me hand and foot kind of. I was completely unable to care for myself in the first week and a half, and I really needed care. My daughter came and stayed with me for the first 4 days, which was when it was most acute and when I needed the most intimate care. So for instance, I couldn't put on my underwear by myself because I couldn't bend over, I needed a little bit of help in the shower, those kinds of things. And my boyfriend certainly would have helped me with those had I asked him, but I don't know. Maybe I want to preserve a little of the mystique. I have no idea, but I just didn't feel comfortable with that. So my daughter helped me with those things. And then my boyfriend, he was also there for that whole time, but he stepped up quite a bit more after the first few days because there was a lot more he could help me with. So just like keeping the house clean and making sure I was getting my meds on time, and feeding me and bringing me water, and, you know, petting me on my, you know, legs or wherever I would let him, because for a while I didn't want anyone to touch me. And just, you know, like listening to me and being a good person, you know. So like I had two people who I really care about actually help me and actually take care of me, and that for me is like a life-changing experience. This forced me to have to trust other people, which, as you know, if you're living with PTSD, and if you're living with trauma, especially childhood trauma, is extremely difficult. Right? Because we learned that we're the only people we can trust, right? Just, I'm the only person I can trust. And I'm not even sure if I can 100% trust myself sometimes, right? So, so I found out that I can trust my daughter to take care of me. And there was certainly something very healing about the person whose sort of entry into the world caused all these problems, being sort of my main caretaker for the first few days after getting it fixed. That was very healing for me. And then secondly, to have a man who I do care about. We've been together for, I don't know, I think like 2 years now, about 2 years. Step up and not only take care of me, but make it very clear that this is not transactional, that this is not like I owe him now, or like he's done something that's like so outstanding that I need to recognize him for it all the time or something. I totally do. I thank him all the time. But he made that very clear, right? This is not transactional. This is not about like you needing to owe me now. There are no strings attached to this care, right? And that too was extremely healing for me. So I've been, working hard to heal physically. I'm about halfway through the healing process at this point. Other than brain fog from the surgery and also from some of the medications that I'm still taking. Like I'm taking a medication for nerve pain, and then also the bladder spasm medication. They both make you drowsy and kind of floaty. But other than that, I feel really good. I'm moving around without any problems. I'm not having any pain. I'm not having any major complications so far. Hopefully the bladder thing will chill out within a few weeks when everything is all healed. But what I have done is I have now taken a huge step to reverse the trauma that happened to my body when I gave birth. And I have had to take an even bigger leap for me to trust people to take care of me when I was completely and totally incapacitated. I did a few days ago actually take a look down there. I decided not to do that at first because I didn't want to see all the stitches, and I just didn't want to see everything all torn up. I wanted to wait until things were healed. And I cried. I looked and I cried because the scar tissue was finally gone. And this is scar tissue, again, that was created because I had an extreme episiotomy when I should have had a C-section. So, none of my sexual partners have ever said anything or seemed to notice it, but it's bothered me, because like it's scar tissue on my perineum and, connecting into my rectum because of this episiotomy that I should have never had. Right. So that's my update. That's it. That's all I have. I'm doing very well. I did have one check-in with my therapist, but it's telehealth, so I haven't done any further EMDR. So when I begin EMDR again, I'll make some more videos. It is pretty spotty right now because of COVID. My therapist is not seeing people in person. Again, she was seeing me on an emergency basis to prepare me for the surgery. But I'm doing well overall, and thank you for your concern, and thank you for watching my videos. And as usual, any questions or comments, please put it down there, and I will get back to you at some point. Have a great day and good healing.